So we've heard in the news recently about the outbreak of measles across the country. We're seeing another one. Well, we'll talk about that where it is in just a moment. But joining us this morning to explain is Baptist Health Pediatrician Dr. Sarah Bone with the Arkansas Pediatric Clinic. And measles we thought was eradicated. We thought it was gone, right? How long ago was it that we didn't hear about this?
Right, around the year 2000 is kind of when we said, hey, the vaccine is very effective, we're getting rid of this. But since about 2004, we've seen several outbreaks every year, and that number seems to be increasing.
Why?
Because there are pockets of unvaccinated individuals in various parts of the country. So people that either choose to not get the vaccine or get the vaccine for their children or do that for religious reasons. But the outbreak right now, the main one is in Washington State. There's about 70 cases there. There's also an outbreak in New York State right now. And then there's been some cases as close as Texas, which is a little too close for comfort for me.
Sure. What is the danger for the kids who have been vaccinated? Most of the kids in the school system here are required to get vaccinated here in Arkansas. What is the danger to our kids at home right now? Is there one?
Well, the more unvaccinated people you have in a group, in a population, the more likely that virus is to circulate. Now, the vaccine itself is highly effective. So 97% of people that have both of the doses of the vaccine that you need are fully protected. But measles itself is highly contagious. So if you're not vaccinated, 9 out of 10 people that come in contact with that virus will get the virus.
That's incredible.
Yeah.
Well, you said 97% or whatever it is. So my kids can still possibly get it, though, 3% chance.
That's true, and that's why it's important to have this community immunity, as it's called, so where as many people as possible are vaccinated so that we see less and less of that virus in the community.
So what is the danger if they do get the measles? I don't even think about it anymore.
Right, because we don't see it very often. So measles starts as a pretty typical viral infection. So you have fever, runny nose, cough, get conjunctivitis, which is the red eyes that you hear about. Then a few days later, you'll develop a rash. A typical rash for measles starts on the face and neck and then spreads outward. And for some people, that's it, but a percentage of people that get measles will get complications of the disease like pneumonia or encephalitis, which is swelling and infection of your brain that can lead to brain damage or even death.
Very dangerous, obviously. Last question is, how do you know if you're due for a vaccine? Maybe it's been so long you don't even know whether you're due for the second one.
Yes, so call your child's pediatrician's office. You can call the health department. We give the vaccine at age 1 and then again at around age 4. It may take some phone calls if you've done some moving or things like that, but those are the typical ages that it's required is 1 and then again at 4.
Dr. Bone, thank you very much. You called it immunity of community, community of immunity. What was it?
Community immunity, which is not my phrase. It's taken from somewhere.
Hard to remember. All right, Dr. Bone, appreciate your time.
Yes.